Well, in just 5 days, uninsured Americans can buy health insurance through marketplaces mandated by the Affordable Care Act.
Now, a lot of people all over the country have questions about the new health care law. Illinois Deputy Governor on Public Policy, Crystal Thomas, is live with us from the Tribune Tower to answer some of those questions. Crystal, it's so good of you to take the time to do this for us. Thanks for joining us tonight.
Thank you for having me.
Well, this is the centerpiece, essentially, of the new health care law. They open on Tuesday. Maybe you can start about telling us about how the process will work here in Illinois.
Sure. So the Illinois Marketplace is going to be the official marketplace, the official website where people in our state will be able to go to shop for plans, to compare plans across insurance companies, to talk to a trained person if they have any questions, and to be able to access financial assistance for them to actually purchase coverage.
And Crystal, I know that there has been a report that Illinois, people here will pay a little bit less than the rest of the country, slightly less. Why is that? And I guess what's the catch, if you can explain that?
So actually in Illinois, I think Illinoisans will be very happy that we have a robust exchange. We have a good number of insurers who have decided to participate in our exchange. We're going to have a lot of choice, a lot of plans that will be offered. So that's one reason when we put out the rates earlier this week, that the rates are a little bit lower than the averages of other states that have also put out their rates. Because we have good competition in Illinois, and we have a lot of choice for consumers.
We checked you out online, and a lot of the answers consumers have, answers to the questions consumers have, I think, are available on your website. We should really link to that, because a lot of what people need to know is available online. Given all the controversy around what we've come to call Obamacare, is the pressure a bit more intense now to really roll this out right?
I think it's important for people to understand that October 1st is the beginning, it's not the end. So yes, now that we are actually here in 5 days, there is a lot more attention to this, and I think people are paying a lot more attention, which is a good thing. It is possible that not everything will work entirely smoothly on the first day. We hope that it will, but the fact is October 1st is the start of when people can get online and start educating themselves, and there will be a lot of time to smooth things out, for people to understand what they need to know and to get enrolled for coverage to begin January 1st.
And Crystal, let's talk about some of those glitches. I know that here in Cook County, we've had what they call county care for the last year, and when that started, and that sort of linked to Obamacare, the Affordable Care Act, and when that started, there were a few glitches, a few issues. Are you concerned that we're going to see the same problems now when we roll this out October 1st, and what do you think those problems may be?
This is one of the largest new programs that we have rolled out in our state, possibly ever. And whenever you have a big new program or a big change, I think the one rule is you need to expect the unexpected. So we have, I think, done a great job in Illinois in putting this marketplace together. I think the consumers are going to have a positive experience. But in the unlikely event that we do have either glitches to our website, to our call center, things will be rolling out over time. And so I just want people to understand and to work with us that October 1st, again, is the beginning. We expect people to be able to go online, to access our screening tool, to be able to put in their information and find out what their options are. But if for some reason that doesn't happen on October 1st, there's always October 2nd and 3rd.
Thank you, Deputy Director of Public Policy, Crystal Thomas. Appreciate it. Live from the Tribune Tower.